Hello and welcome to our recorded presentation about the Active Lives Children and Young People Survey. As it is a recording, if you have any thoughts or queries or questions, then please don't hesitate to get in touch with us after the presentation. Our contact details are shared within the presentation, and I'll be taking you to our website as well, so you can see where the information is all based for you. I'd like to introduce myself to you. My name is Annie Hargreaves. I'm the Schools Officer for Active Dorset, and my remit is to be a local source of advice and support for the survey in the BCP area as well as the wider Dorset. So we do cover all of the county and the schools that lie within it. These are our 4 outcomes, really to make sure that you have a better idea about what the survey is, to share with you how schools could be using the information in it and how some of that information is very relevant for the world of work that you operate in. We also want to begin to network better with you because we feel that we do have shared priorities, and also just begin a conversation, and one that we can share not just with yourselves but with schools and with parents, particularly of younger children. So this is the first question that will appear on our website. Obviously we'll talk about it now, but when a school goes for further information, or you go to look for further information about the survey, everything we talk about is already in place on our website. So just know that it's there should you need it, including this presentation. It will be posted on our website as well for just for future reference. So what is the survey? I'll allow you a moment to read the next slide. And I think the most important part of this is that it is world leading. Oddly, children and young people were not asked about their thoughts and feelings about being active before, but I think last term and the pandemic and the closure of schools has really forced the conversation, if you like, with children and families about their activity levels, even ourselves. So I think it's a very important time, and the survey does ask children questions about their activity in the moment. It captures a snapshot of the week leading up to the day of the survey. So the groups, if you like, that the survey will approach for answers are children in years 1 and 2. They are asked about their attitudes, how they think and feel, how confident they are, do they trust their friendship group, to be active with. Whereas we talk to the parents of children in years 1 and 2 and ask them about the behaviours of their children. It's felt that together those 2 separate survey questions will give a more rounded view of children of that younger age. So like yourselves, when you gather NCMP data, if you're in the school nursing team, you'll be talking to parents of year R and year 6. Similarly, we'll be talking to parents in years 1 and 2. So it's a really nice stage to be speaking to parents. Then children in years 3 to year 11, they are deemed old enough to be answering everything for themselves. So that's another set of survey questions. The questions will appear for a child in a really animated form, an online survey, and they are key stage appropriate in terms of the language that is used and how it looks on screen to the children. But we also talk to the teachers, 1 teacher from every school. It could be the PE lead, it could easily be a senior leader in the school, it could be the SENCO, it could be the health and wellbeing officer. But it's really important that you're aware of the questions that the teachers are asked. So everybody has a survey, if you like, in these 4 groups, and it is online and takes one person, adult or child, just 15 to 20 minutes to answer. So it's not an onerous survey, but it does capture the thoughts and feelings of children around activity now, if you like. National Insight, we have had 2 sets of National Insight already, and the 3rd is pending in December this year, in 2020. And it shares with us the fact that we already know there are health challenges, but the evidence that's coming through the survey is really strengthening the information that we are aware of. So we know there are health challenges, and we know particularly mental health is top of that at the moment for schools, particularly now in the recovery curriculum period, that we're seeing children back in and back out of school again as the virus is affecting delivery in schools. But we also know that regular physical activity is essential for children, and the CMO guidelines recommends that 60 minutes a day on average, that the children should be doing that across the week. And we also know that it's part of the requirement that schools provide 30 minutes of that 60 every day for every child. But I also know in conversation with schools that they struggle to ensure that that happens on top of their normal teaching day. So it's a very tricky thing, but our role is to support schools with how they might approach achieving that 30 minutes every day for every child. The Insight, the National Insight, started being recorded in 2017 to 2018. That was the first academic year. And we know from that data set that over a third of children and young people do less than 30 minutes of physical activity a day. So they don't achieve what they should be achieving. And therefore, inactivity is a huge issue. And we also know that through the pandemic, it was even more difficult. You know, schools that were providing the only activity for children without them even being, you know, up and running, schools and the children from those schools really did struggle. So the government is very aware that not enough is being done, and they are really trying to make a case for urgent change. And if you read the box in pink, I'll be quiet for a sec. So it's really all about influencing what is to come, influencing the future. So I think we all have a part to play in that. And here we have the CMO guidelines in front of us. And this is a conversation we're having with schools all of the time, that what Sport England are looking at is physical literacy. So they're looking at not just what the child is doing, but are they enjoying it? Are they confident, competent? Do they understand the importance of it? And what do they know? And this is what we know because of the results. Enjoyment is the biggest driver for a child to be active. And if you look at the 5th one, active children and young people are more likely to report higher levels of mental well-being if they are more active. So there's a really positive correlation. And so active pupils, we know, do perform better. They are happier, they are more motivated. And if pupil engagement improves, then also school engagement will improve. And the long-term impact is what we're all talking to schools about, is ensuring that they have better health outcomes so they perform better throughout their lives. So what they'll start in school will translate into a more confident, happier, more resilient young person who eventually will enter the workplace. think it's really important that this is a conversation that the government are having at the moment, and they can see, as you can read in this quote, that there is such a strong correlation between physical and mental well-being and academic achievement. So more about the local picture. How do we gather the insight? Well, our role is to be that conduit, if you like, for Sport England. They will select schools and inform us of who they are. And our role is to work with partners such as yourselves, such as schools themselves, to increase the numbers of people who are supported to become more physically active. So it is our role to be that local link, and that sits at the heart of all that we do. So if I, for a second, just swap to our website, you'll see this is the real landing page for our website. And if I take you to the work with us and click on that for a second, you'll see on the left the children and young people. So again, clicking on there will take you to our website. And the top area that we work with schools is the Active Lives Children and Young People Survey. So there we have that first question I shared with you a moment ago, and the answers are all there for you and for schools, and about how they complete the survey. We've created a guide for the schools, and here we can see the selected list of schools for the autumn term. And moving through there, we can also see the spring and the last one, obviously the summer term there. So I've just whizzed through those for you, but it's just to show you that we do have information on our website. So I'm going to go back to the presentation and take you back to the next slide, which is how schools might get involved, who contacts them. Well, as you've seen, Sport England will randomly select specific schools across the academic year. However, a school, if they want to do the survey but they're not on that list, they can opt in. And I would be suggesting to you and your colleagues that it's a very important conversation to be having with them, because at the moment they are actually trying to capture some knowledge of how COVID has affected their physical activity and their thoughts and feelings about being active. So it's a very relevant survey to be taking in the moment. But if a school is randomly selected, then typically 3 classes will be selected and 1 teacher, as I mentioned before. The school can also top up that. So if they wanted the whole school to do it, that's definitely a possibility. So I'm going to move into, this is just the schools for this particular term. And if you were the top school there from BCP Corpus Christi Primary School, then you would have, or they do have, those 3 year groups that have been selected for the survey, and it would be 1 class from each of those 3 year groups, unless the school wants to do more, which is very much their choice. These are the secondary schools, closer look. So how can the survey, so now I'm going to take you a little bit more into 3 things that a school will receive if they if they are randomly selected. The first is a bespoke report, and you can see it will give lots of measures, and I'll have a look at that in a second in a little bit more detail for you. But we hope it basically will give the school their own insight about their own children. And if you look at the image on the right, you might just make out a school name that you've heard of. It's Canford Heath Junior School. So they had this report published in July 2020, so just last term. about a survey they did with their children just before lockdown happened in March, earlier this year. So their report, which we'll have a look at some of the pages of in a moment, their report looked at how children were thinking and feeling and what they were doing about activity before schools closed. And they were very impressed by their report, and they've actually asked to opt in to do the survey again with all of the children in spring next year. So then they'll have their benchmark, which they've already got now, and then they'll have another report coming to them so they can compare the difference between the two. So what does it look like? This is page 2 of an actual report, and you can see that it gives an overview really of activity levels. So over half of the children are being active for the recommended 60 minutes a day. And you can see the attitudes there reflected. That I think this is interesting. 67% say they strongly agree with enjoying participating in physical exercise and sport, but a higher number of children agree strongly that they understand why it is important, and yet that's nearly 10% difference between the two statistics there. But only 28, so less than a third, agree strongly that they find it easy. So yeah, it's really interesting what the statistics will show you. They also have a very strong reading of happiness, which is great. And the location, they're slightly more active outside of school than they are in. But again, that'll be different for every school, and depending on when they do the survey. So now we're skipping forward to page 7 of the report. So there's lots of other interesting information, but for yourselves in terms of health and well-being, resilience and trust is measured, and you can see that the statistics there are really interesting. If you look at the bottom of this particular page, you'll see that the sample has come from 236 pupils from Canford Heath Junior School. So it's quite a significant number of children. It's a very good vision they'll have now of what their children are doing. And again, moving forward, these are some of the questions that the teacher survey will answer, which again, in your professions, you might find it really interesting to have that conversation. And once again, if you look at the bottom here, you'll see in pink writing mention of a healthy schools rating. Well, if the school was to click on that on the live survey that they've report that they have, it will take them to a information about the healthy schools rating, which the Department of Education created, and schools were able to participate in that from September last year for the first time. So Canford Heath Junior School has been awarded with a silver healthy schools rating, and the link at the bottom of this particular slide will take you to the government document that will, it's not a very long document, but it's very interesting. It shows you the breakdown of questions and how they grade the answers for the teachers in order to give a bronze, silver or gold award. The purpose behind creating this was for schools to be able to celebrate really what they do and how they do that. And they want the school to be having that conversation with families, parents, and sharing those successes with the wider school community. Now, if you haven't seen one, it is important for you to know, and I will show you in a moment, the schools that have received a report, and also the schools from last academic year who may have a report with a healthy schools rating in it. So I think it's just interesting for you and us. Now, the schools who are randomly selected will also receive £100 worth of credit. However, if a school just opts in, this is the only thing that they don't get. Every single school, opt-in or randomly selected, they all get the report. So they all have the potential to have, if I go back a slide, the healthy schools rating as well as the data in the report. So it's a really good thing to encourage them to do. And I suppose for us and you, it's it's a conversation piece. If a school has taken the survey, there's data there that you'll be interested in and we are interested in. And if we get enough schools, then we'll begin to grow local data sets. So rather than the national data all of the time, we'll be able to see what children in BCP think and feel and do around physical activity in the same way that we will in the wider Dorset. So if they wish to complete a survey, now you have a bit of information about it. Really, they would just confirm their interest with us, visit our website, which either you can direct them to or we can. And then hopefully, if they need it, we can give them one-to-one support from that point forward. So really, we're asking of you that you have a really insider knowledge now about the survey. So if you are asked a question about it, you could hopefully answer it, you know, in terms of what the survey is a little bit more. So really, please do signpost them to us. That's our website address there, but you've seen where we sit on the website in terms of information about the survey too. And our long-term goals, I guess, are to embed the survey, and we've begun to do that this academic year. We have managed to put these three questions into the survey in the campaign engagement section of a school health profile. And the reason for recording this presentation was really just to let you know that we have been working to try and embed the survey as something that schools do see the value in doing, and hopefully you'll see the value in that for them as well. So these questions already exist, but you might have other thoughts and other ideas about how we can encourage schools to think about taking part in the survey. So this is another long-term goal, is to grow the local insight. Years 1 and 2 are on the left-hand side of your screen. All of these schools have received a report. They've participated in the survey. So they've all got a report, either a full or a partial report already. So if you know that you're visiting any of these schools or speaking to them, then it's worth knowing that you can ask them, would they mind sharing it with you? Also, the schools on the right, these schools participated last academic year, and I've yet to add the latest one that's come in from the summer term. So apologies, it's not there, but you've seen inside Canford Heath school report anyway. But these schools will all have the possible inclusion of a Healthy Schools rating as well as the report, because they took part last academic year. So another long-term goal is really to work in partnership with you. As our website shows, we try and work with partners in the BCP area as well as the Dorset, the wider Dorset, to work together to see how we can align the work that we're all doing and really support the children and young people who sit at the heart of that. So as I mentioned right at the very start, if you have any questions or queries or thoughts or ideas about how we can work together better in the future, then I would be delighted to hear from you. We would like this to be a regular conversation that we have, and you might have some thoughts. So please contact us either at info@ or ahargreaves@activedorset.org and share your thoughts with us. So thank you very much for listening. It's been a pleasure to talk to you, and I do hope this is the beginning of a new conversation. Many thanks.